If you want to know more about complex post-traumatic stress disorder, also known as PTSD, and its symptoms, you're in luck. In this video, we're going to show you the symptoms, causes, and triggers of complex PTSD. Make sure you watch the whole video. We've saved our very best part of the video at the end. Let's jump right in. What is complex PTSD? Complex PTSD is a mental health condition that is caused by a combination of physical and psychological trauma. It is very similar to a post-traumatic stress disorder, but it can be more difficult to treat. Symptoms of complex PTSD can include flashbacks, intrusive memories, and nightmares. Complex PTSD can be very difficult to cope with, and it can be difficult to find a therapist who is experienced in treating this condition. Complex PTSD is a mental health diagnosis that is sometimes given to people who have experienced a traumatic event that is very complex and overwhelming. Symptoms of complex PTSD include severe anxiety, stress, and difficulty managing emotions. The disorder can be very difficult to treat, and people who have it often need special care and attention from a psychologist or psychiatrist. It is more difficult to treat than simple PTSD, and can be very challenging for those affected. Symptoms can include mental health issues such as anxiety and depression, as well as physical health problems such as chronic pain. Those who suffer from complex PTSD often struggle to cope with life, feeling like they are constantly under stress. It is important to seek out professional help if you are experiencing symptoms of complex PTSD, as it can be a very difficult condition to manage on your own. Symptoms of complex PTSD. There are several symptoms that can be indicative of complex PTSD. Some of the most common include anxiety, depression, difficulty focusing, intrusive thoughts, flashbacks, and nightmares. Other symptoms of PTSD and complex PTSD may include difficulty sleeping, avoiding circumstances that bring up traumatic memories, hyperarousal, which means being constantly on high alert, dizziness or nausea when recalling the traumatic event, the idea that there is danger everywhere, a lack of confidence in oneself or others. Triggers of complex PTSD. Complex PTSD is a condition that is caused by a combination of mental health symptoms. In trauma, it can be difficult to identify the triggers of this disorder, as it can be triggered by different things depending on an individual's situation. Some common triggers of complex PTSD include memories of childhood trauma, anxiety, and psychological stress. A person can also be triggered by situations, images, smells, conversations with others, and more. The triggers of complex PTSD can be very varied and can include any aspect of the traumatic event. For some people, the mere thought of the event can be enough to trigger symptoms. The best way to manage complex PTSD is to identify the triggers and avoid them whenever possible. Counseling and therapy can also be very helpful in managing the symptoms of complex PTSD. There is still much mystery surrounding the triggers of complex PTSD, but there is evidence to suggest that mental health issues such as anxiety and depression can lead to the development of this debilitating condition. For those who have experienced trauma that is particularly complex or overwhelming, symptoms can persist for a long time after the original event. Although there is no one answer to the question of what causes complex PTSD, there are many resources available to those who are struggling. With the help of a qualified therapist, those who are affected by this condition can learn to manage their symptoms and live life to the fullest. Before we proceed to the causes of PTSD, if you're enjoying this video so far, be sure to like the video and subscribe to our channel for more videos. Causes of complex PTSD. There are a variety of causes of complex PTSD, and the reasons why someone develops the disorder are often complex. One of the most common causes of complex PTSD is a traumatic event that is too overwhelming for the individual to cope with. This can be due to the severity of the event, the duration of the event, or the way the event was handled by the person or people involved. Other common causes of complex PTSD include a history of trauma or abuse, a mental health condition such as schizoaffective disorder or bipolar disorder, a personality disorder such as borderline personality disorder or histrionic personality disorder, a history of exposure to traumatic events, such as combat or witnessing a serious accident. A traumatic brain injury. There is not one specific cause of complex PTSD, and the reasons why someone experiences the disorder can vary from person to person. If you are worried that you may be experiencing complex PTSD, it is important to speak with a mental health professional. Treatment of complex PTSD. According to research, those who have complex PTSD may require personalized care. To determine the appropriate course of treatment, a doctor will need to look at the trauma history of the particular patient. Complex PTSD, however, can demand a longer course of treatment than traditional PTSD, as well as a wider range of therapy, particularly those that concentrate on problems with self-organization. Treatment options include medication, prolonged exposure therapy, eye movement desensitization, and reprocessing, psychotherapy. While complex PTSD can be extremely challenging to treat, the condition is capable of being overcome. If you are experiencing symptoms of complex PTSD, please seek out professional help. As always, make sure to like this video to show your support, subscribe and hit the notification bell if you'd like to be among the first to know when we drop more videos. Thanks for watching.